Files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al Ansar will be held responsible for any ill health caused by the advice given on Radio Al Ansar.
You are listening to a live broadcast from Radio Al Ansar, Pietermaritzburg, 105.6 FM.
You provided healing. There was some hard times. We were living some dark lives. We did not know where we're supposed to be. We did not know what we're supposed to need. You took the time to teach us, so that the guidance would reach us, and you know we're great. Muhammad ya Rasulullah sallallahu. Muhammad ya Rasulullah sallallahu. عليك وسلم المولى محمد. عليك وسلم المولى محمد. Look up to the best of the men, and I'm working on the test of the end. By following the message he sent, and try turning these lessons into action. Oh, I pray for the day that I see you in my dreams. Rahmatan lil alamin. For all humanity, you gave me the blueprint of life, taught me the rules and the right, shining like the moon in the night. This is how we speak on your life. We was all in need of a kind of center. Muhammad ya Rasulullah sallallahu. Muhammad ya Rasulullah sallallahu. عليك وسلم المولى محمد. عليك وسلم المولى محمد. And oh, I pray for the day that I see you in my dreams. Rahmatan lil alamin. For all humanity. And oh, I pray for the day that I see you.
A'udhu billahi minash shaitanir rajeem. Bismillahir Rahmanir Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh to our listeners on this Saturday morning on Radio Al Ansar 90.4 and Pietermaritzburg 105.6 FM and around the world. We are on www.alansar.org.za. Welcome to the Pulse Show, and I'm your host Shubnum Ismail, who is passionate about empowering you to take control of your health. And today we are talking about something millions of women and men deal with, but almost no one discusses out loud: pelvic organ prolapse. So if you have ever felt pressure, heaviness, or wondered what's normal down there after childbirth or with age, the show is for you. Joining us today is Dr. Sanjay, Sadhwani, urologist, who is going to break down what prolapse really is, the warning signs, and what treatment options exist today. So no shame, just facts. So welcome to the Pulse Show, Doctor, and it's great to have you on Radio Al Ansar.
Thank you so much, Shubnum. Great being here.
Dr. Sanjay Sadhwani has been serving the Pietermaritzburg community through the public sector since 2019 and extended his practice to the private sector in 2023, bringing quality urological care to an ever wider circle of patients. A respected academic, he holds a leadership in the Division of Urology at the University of KwaZulu-Natal, where he continues to shape the next generation of medical professionals. So when it comes to women's health, Doctor is particularly well placed to guide today's conversation. His special interests include urogyne, a field devoted entirely to the unique urological needs of women and encompassing conditions such as bladder prolapse and overactive bladder management. So these are issues, listeners, that quietly affect the lives of countless women, yet are so rarely spoken about openly. So today, we hope to change that. So doctors' expertise, however, extends across the full spectrum of urological care. And Dr. Sadhwani is equally passionate about men's health with a strong focus on prostate disease management with men's sexual health and andrology. He also brings significant experience in uro-oncology and minimally invasive urological surgery, ensuring that patients receive the most advanced and compassionate care available. So in this way, listeners, his practice truly serves the whole family. Beyond his clinical and academic work, Doctor is a man of remarkable energy and avid marathon runner, cyclist, and hiker. So, reflecting the same dedication and endurance he brings to his medical practice every single day. Wow. We're very lucky to have you on the show here today, Doc. So, Doc, can you tell us what exactly is the pelvic floor and what does it do for men and women?
Sure. Firstly, good morning to all our listeners. Thank you for joining us. So, look, the pelvic floor basically is a set of muscles, about 26 muscles that sit in your pelvis. And what they actually do is help lift up your pelvic organs, so namely your bladder, your rectum, and your uterus. That also includes the pipe from the bladder to the urethra. Now, why this is important is the way I want you to think of it is think of it as a hammock. You know, when you go to Drakensberg and you're sitting on a nice, beautiful property there, you lie down in a hammock and that basically supports all your weight. Now, this hammock's function is to lift up all these organs and keep them supported so that when there is increase in your pressure in your abdomen, let's say when you're coughing or when you're sneezing, it basically mitigates that pressure and prevents it from causing your organs to fall down. Now, as we get older, this hammock or trampoline doesn't work as nicely. So instead of it bouncing back up, it kind of falls down. And all that pressure in the stomach gets translated to the rectum, to the bladder, or to the uterus. And that's when you have these feelings that, oh, wait, hold on, something's sticking out of the vagina. And you can feel some bulge. You can feel leaking in your urine when you cough or sneeze. You feel like you need to run to the toilet. You get bladder infections. And sometimes you may even have difficulty passing stool or have constipation where you need to do some maneuvers to help you pass the stool.
So tell us, Doc, what is the difference between pelvic organ prolapse, urinary incontinence, and overactive bladder?
Sure. Yeah. So pelvic organ prolapse is a very fancy term. Basically, what it effectively comes down to is something sticking out of where it's not supposed to stick out from. And, that can be either from the vagina or even from the rectum itself. And often it's the bladder that's falling down, most commonly. But sometimes the rectum can also fall out of the vagina. So my patients often come to me like, doctor, you know what? I don't know what happened, but for the past month, I feel something like there's a bulge there between my legs. And it's, it's not there all the time. Sometimes I can push it back in and it goes away, but it comes back again when I'm walking or standing up. And that basically means that the bladder is either falling down or the uterus falling down or the rectum. So that's pelvic organ prolapse. With regards to urinary incontinence, that's also, in our medical fraternity, we have lots of fancy terminologies, but that's again another fancy term for saying your urine's leaking. And it's leaking maybe by itself, or when you cough or when you sneeze or when you're walking, or sometimes just before you get to the toilet, you're running, you get there. Before you can get there, you wet your pants. We call that urgent incontinence. Lastly, the one we mentioned was overactive bladder. That's nice. That's quite simple. Basically, your bladder is extremely overactive, where you feel like you need to run all the time. I had a patient the other day who told me, doctor, she's seen me after about 6 months from the problem when it started. She said, I'm going to pee 10 times at night. And I'm like, I couldn't believe it. She's like, I don't sleep. And just by looking at her, you can see she's exhausted. She's tired. We managed to get a good treatment strategy for her, and now she's going 3 times at night. So these are the overactive symptoms that they often get, not only at night, sometimes it's during the day as well. And they can't function in society. They can't function at work. They have to get a chair in the office close to the bathroom. They feel embarrassed because their colleagues think that they're just, trying to take.
It's the best sooner they get to see you. I mean, obviously intervention can happen.
Look, I'm honest enough to say that not everything can be repaired, but what I can say is that we will definitely try, and we can at least. Sometimes it all is, everyone's anatomy is different, so you can't promise that you get normal. Right? To improve your life into this possible state that we can get you to improve your life. I mean, even for this patient, we didn't take away her frequency from 10 to 0. I took it to 3. But she's saying, doctor, I'm sleeping for the first time. And she's, she came back and she was fresh. She's looking good. And that's what you want,
And listeners, this is what the show is all about. It's about improving your lifestyle. So, doctor, tell us, how common are pelvic floor disorders and who's most at risk?
Yeah, unfortunately, it does discriminate a bit, more in females than in men. In terms of the incidence, I'd say 25 to 50%. So basically 1 in 2 women have a risk of having some form of pelvic floor disorder, which is very common. And thinking of that, I I mean, if it's 1 in 2, and a lot of patients don't even know about it, or they do know about it, but they're a bit scared to be out in public because it's something that's exceptionally embarrassing. But we're living in a different world now, where information's at our fingertips. People are a lot more open-minded, and I think simply just talking about it will show you that there's lots of solutions at play that can improve your quality of life.
I know we actually focus more on women, but very important. It's Men's Health Month, and can men get pelvic organ prolapse as well?
Absolutely, yeah. So men often do. They can, not often, but they do. And in those situations, they often have bladder or bowel control problems. They can have sexual dysfunction. They can have the severe pain in the pelvis that just nags them all the time, or even lower back pain. And in men, more commonly, it's related to inflammation or infection in the prostate. We call it a prostatitis. But that we can pick up with the workup, yeah.
So, in your opinion, what is the early warning signs that people usually ignore?
So, I think the most common thing is, women often get to have a leak in the urine. It was really funny, so I was laughing, and then I just leaked a little bit of urine, and I've seen this happen. Unfortunately, that's not always true. Even if it's a really good joke, so I tell my wife, it's really funny. She must leak a little bit. No, she doesn't. But generally speaking, you should not be leaking urine. If it is, it's and often it starts off once in a while. It happens when you have the flu. It happens when you have a severe cough or a bit of bronchitis. That's your body telling you, look, yes, it's happening at a time where you're under severe strain, so it's not as severe yet, but that should not happen. Your muscles should be strong enough to protect you, even if you're having a flu or an asthma attack or bronchitis. It should not happen. That being said, there are many solutions to it. So it's not something that you need to despair about or feel bad about. There's some non-operative ways of fixing it. So there are methods to do it, both surgical and non-surgical. And I think it's just important that you seek help for it.
And does childbirth always damage the pelvic floor, or only certain types of delivery?
So look, yeah, that's the thing. So childbirth itself generally doesn't. However, if the childbirth process is complicated, and when I say complicated, if they had some form of operative vaginal delivery, so if there was forceps used or vacuum devices, or if ever they had to make any incisions in the vagina to help the process, sometimes, you can't always anticipate how the delivery is going to happen. So if ever there's had to be instrumental intervention, then that actually stretches out the muscles and causes damage to the muscles. So in those cases, it can happen. In normal, basically uninstrumental vaginal deliveries, if it's a prolonged process, let's say the baby took a long time to come, the head was a bit big, the second stage of labor is about 2-3 hours. In those cases, there's also strain onto the muscles. And remember, the more babies you have, the more impact onto the muscles. Then other factors like pelvic surgery. So you had a hysterectomy, you had ovarian cyst removal, something that involves surgery within the pelvis, that also damages the muscles.
So how do heavy lifting, chronic coughing, or constipation affect the pelvic floor over time?
It happens with all things that you mentioned. Effectively, you're increasing the intra-abdominal pressure. So lifting heavy objects, or when you cough, all the pressure from your stomach has to go somewhere. And, it goes back to Newton's laws, action and reaction. So this pressure the pressure has to go in some direction. And unfortunately, if we have a big stomach, or because of gravity when we're standing, that pressure goes down into your pelvis. And as I said, the trampoline is what protects you. So those 26 muscles of your pelvic floor, they protect you. But for any reason, if they're weak, that trampoline can no longer bounce back. It just sinks down. And when it sinks down, it pushes your bladder, your rectum. And when it pushes your bladder, the pressure in the bladder is too much to overcome. Remember, a female has a very small urine pipe, not like a man. It's about 4 centimeters. There's not much resistance to flow. So the moment the pressure hits the bladder, it unfortunately leaks. And that's when the woman will say, I cough, and it just comes out, doctor. And it's like a tap.
We spoke earlier, and you obviously see a variety of patients, from babies, etc. So let's talk about the patient that is obviously going through menopause. How does the pelvic floor weakness affect, obviously, age?
Menopause is a hard time, eh? It's not easy. So I have a lot of respect for women going through menopause, because there's a lot of changes in your body, and one of them being the estrogen exposure and collagen as well. And unfortunately, estrogen and collagen is instrumental in maintaining healthiness of the tissues. Take away that, and unfortunately, tissues start to degenerate. They get atrophied, which means they get weak. The muscles get smaller. The tissues change, and then add that to normal wear and tear of being utilized for the past 50, 60 years, then the muscles just tend to wither away and get weak. So, yeah.
And in terms of obesity or being overweight, Doc, can you probably tell us, can that increase prolapse or incontinence in a patient?
Shubnum, absolutely. What happens with obesity is that, again, now you have a baseline. So let's say your abdomen's fairly large. All that pressure has to go somewhere. And as I said earlier, it goes down to the pelvis. So what I tell my patients is that, look, in order to make it, the idea when we sort these patients out is not just to do a procedure or give treatment, but to treat the cause. And the cause often is, one of them is obesity. So I advise exercise and weight loss. That sometimes is also very difficult. Like a lot of people try to lose weight, and it's easy to say, listen, you need to lose weight, but the reality is that it's extremely hard. And a lot of patients who are overweight are not there by choice. They're not choosing to eat. They may have, inherent insulin resistance or cortisol increases, or taking steroids that help them put on weight. The issue is here, the main thing is that we treat the actual cause itself. So diet, getting a dietitian involved, exercise, and other things, other causes as well. Like, so if ever patients had bronchitis or is a chronic asthmatic, we need to address that, because that cough that they have every night over the past 10 years, we need to treat that in order to prevent that added pressure coming down into the pelvis.
Do high impact sports like running, I know Comrades is coming up, or CrossFit weaken the pelvic floor?
That's interesting, hey? Like, you wouldn't think so, but actually there is some evidence to say that high impact sports like CrossFit or even running, what it does, it puts repetitive pressure on the pelvis itself. Remember, if you look at CrossFit, there's a lot of situations where it's rapid, high intensity workouts. So you're jumping and you're squatting, jumping and squatting. If you look at that, that's not a normal movement that you would do day to day. It's really good for your heart and for your muscles and your physique. But if a patient's pre-existingly having already weak muscles, then you're in a situation where you're putting those muscles under further strain. So yes, running and CrossFit can actually worsen your symptoms. Those trying to do something that's equally beneficial in terms of your cardiac health, but not as high intensity. So swimming, going for walks, cycling, along with then doing something like pelvic floor exercises or Kegel exercises that strengthen the muscle.
So, Doc, can you tell us, how do I know if what I'm feeling is normal aging versus a pelvic floor disorder?
Yeah, so the truth is you don't, eh? And the thing is that most people actually don't, and it's very difficult to differentiate the two, not just for the patient, but also for the doctor. The fact is, if you're having symptoms, if you're having a bulge, or you feel like something's bulging out, or if you feel like you've been getting recurrent bladder infections, or your urine's leaking, or you're running to the toilet a bit too much. Another thing I wanted to mention is that some patients, it's a very unique kind of thing, and it might sound a bit invasive, but I need to tell you people about this because it's very common. Patients come and tell me, doctor, I can't pass stool. And then she'll say, doctor, I'm scared to tell you this, but it's embarrassing, but I have to put my finger in the vagina and push it back, and then I'll pass stool. We call that splinting of the rectum. What happens is the rectum actually falls out of the vagina, and basically the stool gets deposited within there. So when they put their hand in the vagina and lift up, it straightens out the rectum and allows the stool to fall down nicely. That to me is, if someone tells me that, I know exactly what's going on. I know that they have a rectocele, which means the rectum is falling down into the vagina. And basically there's a procedure we can do to help repair that. And then they pass stool so amazingly. It gives them such good quality of life. And these are patients who've been taking laxatives for 6 years, 10 years. They just assume that there's something wrong.
It makes me wonder, Doc, that there's so many patients out there silently probably self-diagnose or self-manage some of their ailments with being, obviously the feel of being judged or the shyness of actually approaching a doctor and talking about these things. But listeners, this is reality. And that is the reason we have Dr. Sanjay Sadhwani with us in studio today. And he's talking about pelvic floor prolapse, incontinence, which is something that everybody will at some point go through, and we're here to actually diagnose, help, treat, and give you the right tools. With that said, we're pausing here for a quick advert break. So don't go anywhere, make the cup of coffee, and we'll be back in a moment.
Teaching you something new every day.
Radio Al-Ansar.
Welcome to Simplex Radio. Visit our showroom for the full range of car audio. Our TV department carries top brands with quality LED panels, full HD to Ultra HD, and now the experience of Super Ultra HD. Visit our theater rooms and transform your home with brands like Onkyo, Integra, Denon, Boston Acoustics, Yamaha, and more for quality audio visual experience. Now available, full range of home appliances. A one-stop shopping experience. Call 031 306 4029 or Kenilworth Park, 202 Brickfield Road, Overport. Simplex Radio, the name you can trust.
At Absa Islamic Banking, we get that the first lessons about money are never just about money.
2, 3, 400.
And what do we do with it?
We save some and we give some.
That's my point. They're about responsibility, generosity, principles, and banking that honors your values. Get an Islamic youth account for your children, plus discounted banking for your spouse with Ultimate Islamic Banking. Apply online. Your story matters. ABSA. T's and C's apply. ABSA is an authorized financial services and credit provider.
ادع إلى سبيل ربك بالحكمة والموعظة الحسنة وجادلهم بالتي هي أحسن. Invite all to the way of your Lord with wisdom and beautiful preaching, and reason with them in a way that is best and most gracious. Join Shabir Pasha every Saturday at 7 p.m. on the show Dawah Dynamics, and every Sunday on the Dawah Chronicles at 9 p.m. remembering the companions of Prophet Muhammad, peace be upon him. Join the discussion, analyze the life, sacrifices and contributions of the Prophet's companions, and learn from their experience.
Station for conversation. Radio Al-Ansar.
Doctors and guests on a medical files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al-Ansar will be held responsible for any ill health caused by the advice given on Radio Al-Ansar.
أحسن ما يقال عندي بسم الله بك نبدأ في سلطان جسدي مع الزكي يا عين وحدا مثل حلال اللي تسدي تبني شهادة فوق شهادة يا محمد يا سيدي صلى الله عليك نبدأ سيدي صلى الله عليك محمد سيدي صلى الله عليك اللهم صل وسلم طول الدهر على نبينا نجوم الليل والكريم استخلاف
Assalamu alaikum wa rahmatullahi wa barakatuh to our listeners on this Saturday morning on Radio Ansar 90.4 and Pietermaritzburg 105.6 FM. I'm Shubnum Ismail on the Pulse show, capturing the heartbeat of our community, and we're glad to be back, and we're diving straight back into the good stuff. So today we are talking about pelvic floor prolapse with Dr. Sanjay Sadhwani, a leading urologist in our city of choice. It's great to have you with us, doctor.
Thank you so much.
So let's get started. So doctor, tell us, what does pelvic organ prolapse actually feel like? Is the bowel sensation dangerous?
Sure. So I wouldn't say it's dangerous. There's no imminent danger unless if it's causing some kind of blockage to the kidney. In terms of what it feels like, every patient has a different way of describing it. The most common thing is that, doctor, I get this fullness that I feel just at my bladder, and sometimes it feels like it's coming down, and I feel like it's going to fall out. So that's actually a very common kind of symptom that they describe. And some other patients say, like, doctor, it feels like a ball, like a balloon, and it moves in and out. And sometimes it actually does. It actually pops out, and they can sometimes push it back in, and then when they stand up or put pressure on the abdomen again, it pops out. We call that like a reducible prolapse. From experience, I can tell you, one of the worst ones I've seen is a grade 3 prolapse, where it was actually sting all the way down to the mid thigh of a patient. And this patient had, what would actually happen is when she would walk, it would scrape between the thighs and cause excoriation and bleeding. She was an 81-year-old female, and it was tremendous what she had been through. And she just thought it was part of her life. And then she came through. I booked her for a surgery to repair it, and she couldn't believe afterwards how she was able to walk. She could do exercise again. She would go out because she would stop going out because she was scared that leaking urine would make other people smell it, and she was very conscious of it. So her confidence improved, her lifestyle improved. It was something that made me feel very nice because we managed to make a difference in her life and her day-to-day living.
Thank you, Doctor, and to all of the other surgeons out there who do tremendous work day after day to give the gift of life. So, Doctor, why do some people leak urine when they laugh, sneeze, or exercise?
So, in my opinion, it's because my joke was really good. But by and large, it's all dealing to do with the pressure in the abdomen. So, what happens when you laugh or you sneeze or you exercise, or even if you're lying down and suddenly stand, when you move forward, the pressure that was lying distributed over your flat body now changes, and all the weight from your abdomen gets pushed down to your pelvis, and that now causes you to leak. And that's just a reflection of that hammock or that trampoline, the pelvic floor muscles that have just worn out and gotten so weak over time.
I see a question has come from one of our listeners. Is frequent nighttime urination always a prostate issue, or could it be pelvic floor related?
So yeah, that frequent nighttime urination in men, we call that nocturia, is very, very common in patients who have big prostates. And the reason for that is because the prostate sits just at the back end of the urine pipe. And what it does, as a man gets older, it gets bigger and it blocks that urine pipe closed. So when a man pees, he pees, but he doesn't empty out his bladder fully. So for example, if he had 500 mils in his bladder, he pees about 100 mils. So he has 400 mils left behind, and he goes back to sleep. And then within the next 45 minutes, he fills up that extra 100 mils, and his capacity is at 500. So he needs to go again. But then he doesn't empty again. He only pees 100 mils. So then that gets quite frustrating. However, there are other causes of nighttime urination. So the most common and important one would be cardiac. So if you've got a patient who's known diabetic, hypertensive, has cardiac issues, what I do for them is I do a workup for them as well. I don't just treat the urology aspect of them. We have to look at patients as a whole. So I'll do a basic test on the heart to check the echo to see how their heart is pumping. I'll examine their legs, see if the legs are swelling. If the legs are swelling, its chances are this nighttime urination is not because of the prostate, but because all that fluid that's sitting in their legs during the day that's swollen, when you lie down, all that fluid goes back to the kidney. Now the kidney gets a job and says, hey, hold on, I've got more urine coming to me. I need to make more urine. So the kidney at night is working overtime because suddenly there's this fluid that was sitting on the legs. It's now coming back to the circulation, to the body. So it makes more urine and then you pee more. But it's very important to differentiate those two from each other.
So when should someone stop waiting and see, obviously, somebody like yourself or a urogynecologist?
Look, I think it depends on your symptoms. If it's impacting your way of life, if it's causing you social anxiety or embarrassment, if you're having bladder infections, if you're getting pains, if you have something sticking out of the vagina, or you have an overactive bladder and you feel like you need to run all the time, then please definitely see a specialist. I think that's extremely important because the main thing here is, I work on this principle of prevention is better than cure. And I also work on the principle that if you pick up something early, you have a variety of options available to treat things. As it gets later on, it's not like we can't. We absolutely can. But I like to be able to choose the least invasive option for a patient and not rush to the last resort, which may be surgery. So I like to start stepwise and not just rush into operative procedures because some of our patients are high-risk patients. Some of them are, as I said, cardiac patients, high-risk. They've had strokes before. So in those patients, I'm a lot more cautious in trying to see if we can mitigate these symptoms with, other like conservative approaches first.
So, Doc, tell us about the steps that you take with diagnosis and testing. What happens during a pelvic floor exam? Is it painful, embarrassing? And do you use such elements such as ultrasound or other tests to diagnose incontinence?
Absolutely. So, look, I think the most important thing, and especially in treating a female patient, is extremely respectful in general. It's a very embarrassing kind of situation where you have to now expose something you're already a bit self-conscious about. Going just by and large, it's generally not discomfort. It's not uncomfortable or painful. We use anesthetic gel when we're doing examination. Ask the patient first if ever they are comfortable with doing an internal examination. They're absolutely fine. Why do it under anesthetic? I'll look, do an exam under anesthetic, so you don't have to feel comfortable. At the same time, we can try and sort out the problem if there is. So yeah, by and large, it's not painful or embarrassing at all. Ultrasounds are amazing. So we have transvaginal ultrasounds now that basically, you can scan into the bladder and the pelvic organs, and you can see the organs falling down. There's a few X-rays as well that we can do that help determine what's going on inside the bladder. So yeah, technology has advanced so much that it's not like in those days where there was a lot of manipulation and the doctor sitting for 5-7 minutes with a ruler inside the vagina. Those days are pretty much gone now.
And what are pelvic floor Kegel exercises, and are people doing them wrong?
Yeah, the Kegel exercise, that's always a controversial thing, hey? So look, the Kegel exercise is basically a way of engaging your pelvic floor muscles to strengthen the support of the bladder. By doing that, you are, how do I say this? You are rebuilding or strengthening the trampoline. So it's a trampoline that's sitting in your house where your kids have jumped on for the past 50 years, and suddenly now it's starting to wither away. So what you're doing is kind of like putting a new layer of trampoline on it. You're trying to build that muscle up. The issue with it is that some people do it wrong. So instead of exercising the correct muscle group, they are exercising the gluteal muscles or another muscle, which can lead to more problems than benefit. So my recommendation is do it under advice of a trained professional, whether it's a urologist or even a physiotherapist. There are very good physiotherapists who do pelvic floor exercises. It's important. From experience, though, it works for as long as you do it. So if you stop doing the pelvic floor exercises, your symptoms come back. So it's not a permanent solution. And the reality of life is that we are so busy. People don't always do these things every single day. It's difficult. So a lot of patients come to me like, doctor, look, I did it. It worked, but I'm struggling to do it every day. And when I'm not doing it, the problem comes back. Can you help me with a better solution? And that's when we would intervene.
So obviously the journey with the patient is not a once-off. Obviously you build and sustain that relationship. You work with a multidisciplinary team to ensure that a physio is guided in to actually ensure that those therapy and those results are managed well. But in terms of physical therapy, how long does pelvic floor physical therapy take to show results?
Yeah, that's the thing. This is another reason why people stop it. It takes 6 to 8 weeks. So, what happens is that human nature is such that if you don't see results immediately, and we currently in a world where we want results now, people often stop doing it. They're like, look, I did this, doctor told me to do this, and I'm doing it, and it's not working. It's been 1 week. It should have been better by now. And the truth is that muscle has been weakened over the past 50 years. So it does take about 2 months to get some strength back. The way I explain it as well is like, look, if my biceps are small, and I start lifting a 10 kilo weight every day, it's going to take a month to have some benefit, and maybe 3 months to show a reasonable bicep. And that's the same thing. It's the same kind of muscle group we're talking about. It takes time to get stronger.
Listeners, we're going to pause for a quick nasheed break. Don't go anywhere. We have Dr. Sadhwani with us here in studio in Pietermaritzburg. You're going to join us again just in a moment.
Gaza needs your support more than ever. Homes have been shattered and families have lost everything. With your support, our teams are delivering clean water tankers, feeding the hungry, and assisting orphans who have no one left. Let us give Gaza whatever help we can. African Muslims Agency, empowering, educating, inspiring.
This and only this is Nightline. Nightline is the only program that allows you to listen to the opportunity to voice your opinion on any matter or any topic that concerns you. Also on Nightline, we interview the famous, the not so famous, and infamous. Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Brother Muhammad Variawa, and with me in the studio is Dr. Anwar Jiwa. Join us every Saturday night from 8:30 p.m. till 10:30 p.m. on Nightline, the program designed especially for you, the listener.
Radio Al Ansar.
Doctors and guests on a medical files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al Ansar will be held responsible for any ill health caused by the advice given on Radio Al Ansar.
He makes the birds fly. He made the blue sky. He makes the sunrise. That's Allah. He makes the clouds cry. He calms the seas tide. He makes the wind dry. That's Allah. Which of the favors of your Lord can you deny? Read His words. He's a creator, the master, the majesty of the universe. La ilaha illallah, la ilaha illallah, la ilaha illallah. When life's a hard fight, and when we lose sight, He'll make it alright. That's Allah. We can never lose hope, 'cause we're never alone. We're holding on to His rope. That's Allah. Which of the favors of your Lord can you deny? Read His words. He's the creator, the master, the majesty of the universe. La ilaha illallah, la ilaha illallah, la ilaha illallah, la ilaha illallah, la ilaha illallah. Do we ever wonder about all the things around us? Everything just works as compassion surrounds us. Always gives me what I need. He's the only one I need. I put my trust in Him and all that He decrees. La ilaha, la ilaha, la ilaha. There's a messenger was sent with peace by God's decree and revelation. There's an angel, the perfect creation, made a light wings from the sky. He wasn't tainted. Oh, there's an angel, جناحه يملئ الآفاق من ريشه ينزل اللؤلؤا.
Assalamu alaikum wa rahmatullahi wa barakatuh to our listeners on this Saturday morning on Radio Al Ansar 90.4 and Peter Marisburg 105.6 FM and around the world www.alansar.org.za. I'm Shubnum Ismail on the Peter Marisburg Pulse Show, capturing the heartbeat of our community. So unlock your health potential with expert guidance. We have Dr. Sadhwani, a leading urologists who's sharing valuable insights and practical tips on management of pelvic floor prolapse. So let's get started. We are here to prioritize your health journey together as we dive straight back into discussion. Good morning, Dr. Sadhwani. It's great to have you with us.
Thank you, Shubnum.
So can weight loss, diet changes, or treating constipation actually improve symptoms?
Yeah, absolutely. I think so. Weight loss and diet changes will actually help reduce the the abdominal pressure and the obesity that we spoke about that puts pressure on it. Constipation as well. So that's a back end pressure that pushes against the bladder that prevents it from emptying adequately. So if you release the pressure from the rectum, you also take the pressure off of the bladder and allow them to empty a bit more adequately.
Are bladder training and time voiding effective for urge incontinence?
Yeah, look, they can be. Time voiding and bladder training often works in some situations. But if a patient has true overactive bladder, sometimes the actual cause of the overactive bladder is that the nerves itself are overstimulated. So just consider them as being hyperactive. And often in those situations, you can try time voiding and bladder training, but the patient will tell you, look, you told me to pee every 4 to 6 hours, but now I'm going every hour. So the timing of the voiding doesn't actually help enough with them. And in those situations, there's a beautiful set of medication that works very well. And sometimes I've had very good results by doing Botox into the bladder. Often people just think of Botox it's for their cosmetic reasons on their face, but Botox in the bladder actually gives them long-lasting relief. It can last up to a year. And those patients going 10, 12 times at night are going as 2 to 3 times at night, which is wonderful.
I know you touched on this earlier, but one of our listeners wanted to know she doesn't go to the bathroom as frequent during the day as she goes at night. So just wants to know this hourly urination. Can you give us some sort of advice?
Absolutely. Look, it's also hard to comment on an individual without examining or getting a full history. But by and large, sometimes, and this is not particularly directed at her, but in a patient who goes more at night and not so much in the day. Remember, during the day, we are occupied. Our minds are kept busy. We have duties, we have work, we have functions. So we don't have much time to focus on our stresses and our anxiety. And we're working in a high pressure environment in the world right now. There's a lot of anxieties and stresses that we all have to go through. And that manifests into bladder symptoms. So, I just would like to know in those situations, like if it's happening particularly at night, is there a social stressor? Is work troubling you? Is there some kind of anxiety that does it? Are you sleeping well? A lot of patients who don't sleep well, when I don't know if this ever happened to you where you are in the middle of the night now and you're not able to sleep. You're like, let me just go pee. Maybe and then you go take a visit. Then you're like, you pass by the fridge, get some water, your throat's a bit dry. Then you go pee again because you're not actually sleeping. And you're not peeing because you need to. You're peeing because you're awake. You want to do something.
But as you said, you got to do a full body analysis.
Absolutely.
And it could also be diabetes.
It could be a cardiac issues. It could be, fluid retention. There's many factors. And I think a workup would help that patient.
So, Doc, let's unpack surgery a little bit. What's the difference between sling surgery or for incontinence versus surgery for prolapse? And if you would like to touch a little bit about the mesh surgeries.
Sure. So look, a sling surgery is basically a tape. It's a tape made out of a particular kind of material. And what that does, it basically lifts up the bladder neck and the urethra. So what it does is that it gives you that added support of the hammock or the trampoline, as I mentioned, and holds your kind of bladder up so that when you cough and sneeze, the pressure doesn't go directly onto your organs, but more so the mesh kind of gives you that added, that your muscle was giving you, giving you that support that it was giving you. The prolapse surgery is actually taking away that bulge that's there. So that bulge that's there, you're basically repairing it, pushing that bulge or that bladder back up to where it's supposed to be and stitching the tissues to keep it there. Now, there's many ways of doing that. There's ways that you can do it, which are short-term solutions, and there's ways you can do it that are long-term solutions. I recommend for my patients as a urologist, doing it as a long-term solution. So we do a bit more of an intricate procedure that is harder to do, but the results are significantly better, and the risk of recurrence is a lot lower. The meshes, by and large, most urologists don't do it anymore. And the reason for that is that there were a significant amount of complications with meshes in the United States. So we don't like you doing it. I don't do it in my practice. And the reason for that is because it can lead to chronic pelvic pain, discomfort. Sometimes the mesh can come out or extrude into the bladder. So we try and avoid using that on all aspects here.
So, Doc, what's the recovery period like? And can surgery fail or does prolapse come back after treatment?
So look, I think the truth is that everything has a potential of failing. The chances of that happening are low, I must be honest. But again, this is where you empower your patient. The idea is not just to solve the problem or do the surgery and just, that's the end of it. I think the work has to be done also by the patient themselves. So if you're smoking and the smoking is causing a chronic cough, I'd recommend to stop smoking. If you have undiagnosed reasons for cough or bronchitis or asthma, we get that treated. So we'll ask a colleague or someone to help us treat that. I think the idea here is to treat the problem. If you're obese or you're overweight, let's try and get you onto a diet program. We might not get you, having a six-pack, but that's fine. We don't want you to have a six-pack. We just want you to be better than you were before. And I think that's the goal. Just be better than you were yesterday. If we have that goal, we make it achievable for our patients. I think sometimes we put too much pressure on the patients, being like, listen, no, you need to lose 25 kilos. I'm like, oh my God. Because I can imagine, sometimes you're at the gym, you're trying to lose, you're there for a week and you realize you actually didn't lose weight, you put on weight, you put on some muscle, and this can be very discouraging. So I think keeping practical goals for a patient for something that's achievable. Once you see they get that small goal, then they're motivated to go for the next goal and they're motivated to go for the next goal. So it's all about just making achievable goals for our patients.
Doc, it fascinates me that I've been in the medical field for over 25 years, that, the robotics, the advancements in medicine, and especially when it comes to urology. You guys have obviously brought first world medicine to South Africa, and you're giving patients an opportunity to obviously thrive and obviously lead a better lifestyle. How do you keep up to date with some of the advancements in medicine?
Absolutely, 100%. The urology is one of the best fields. I have a great passion for urology. I've always loved it. Look, on my side, the way I keep up to date is I just keep learning. Hey, I don't. Even maybe just 3 years ago, I went for a conference to learn some new surgical procedures. I'm going again next week. The goal is that you stay humble. So at no point must you think that you know it all. And don't be shy to get help. Don't be shy to learn. Don't be shy to read. And I think because medicine is perpetually advancing, you cannot just assume that things are or you can't just keep doing the same thing you've done all the time. Just because you were good at something doesn't mean you must keep doing it. You have to change. You have to grow with the times. And you also have to listen to your patients, because not two patients are the same. Just because they present with the same thing doesn't mean they need the same operation.
Mm-hmm. So, Doc, there obviously might be quite a few myths, but what's the one misconception about incontinence or prolapse you wish everyone knew?
Yeah, look, I think the most common misconception is that it's normal. It's normal for a female to leak. It's normal for a female to get bladder infections. Look, don't get me wrong. If you're getting one bladder infection a year, that's fine. And that's understandable. I mean, it is more common in a female. But I think the most misconception is probably that, I have to live with this. I'm old. And that's not true. Mm-hmm. If you look at the United States, United Kingdom, patients who are 80, 90, 95, even 100, they are getting pelvic organ surgery purely because their lifespans are looking to be very good and they want a good quality of life. Remember something, if ever you having problems like this, all that's going to lead to is you sitting at home and doing less work actively. And that in itself will cause more trouble than the urine itself. So making a patient more mobile, getting them back and running into society helps them also lead a better lifestyle and overall health.
So, listeners, we are wrapping up. And Dr. thanks for joining us and sharing your expertise about pelvic floor prolapse, which is such an important issue. Is there any final words, and how can our listeners get in touch with you? And where are you based in Pietermaritzburg?
Sure. So I have rooms at Midlands Life Hospital. It's block D109 on the first floor. And then I'm also in Hilton Life Hospital at the Hilton Health Building. And that's on the first floor, Suite 7A. I can give you the room's number. I'm also in Howick Hospital, Lenmed Howick. But I treat patients in all hospitals in Maritzburg. So Mediclinic, St. Anne's, Eden Gardens, all of the hospitals. And if you need to get in contact, the contact number is 033 015 5109. And the emergency number is 072 905 0745.
And it's also Men's Health Month. Is there any special message you'd like to give to our men out there?
I'll tell you something. Being a man myself and treating all the men, I can tell you we are terrible patients. Men are notoriously, we don't talk about our problems. There's a lot of things that we don't want to discuss. But in this day and age, there's so many solutions that we can find. Sexual dysfunction, leaking urine, poor flow, prostate cancer. I would say the most important would be prostate cancer. A simple test like a PSA, it's considered about 80 rands or 60 rands, depending on your lab. It's a simple test that you can do from the age of 40 onwards. and they recommend doing it once a year. Just do that test. If it's high, it can highlight prostate cancer. And if we pick up the cancer early, we can cure it. Not just treat it, we can cure it. So I just recommend patients just do the PSA screening.
Jazakan, thank you so much for being part of the Pulse show today, Doctor. Listeners, remember it's common, it's treatable, and you're not alone. Your health is your wealth. Invest in it daily. Jazakallah so much for plugging into the Pulse show. To our technician and the Al Ansar team, Jazakallah for letting us get connected with the community. From myself, Shubnum, Ismail, until next Saturday, I'd also like to give a loud shout out to my brother Ashraf Ismail on his birthday today. Until next Saturday, take care. Assalamu alaikum wa rahmatullahi wa barakatuh.
Medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al Ansar will be held responsible for any ill health caused by the advice given on Radio Al Ansar.
Radio Al Ansar, 24/7, 365.